Comprehensive Primary Care CPC initiative worked to improve care, improve health, and lower costs for patients and their families in the primary care setting. Nearly 500 primary care practices and more than 2,000 practitioners were enrolled in CPC from 2012 to 2016. The CPC initiative focused on 5 functions of primary care: access and continuity, planned care and population health, risk-stratified care management, patient and caregiver engagement, and coordination of care across a medical neighborhood. This on-demand learning series explores how CPC practices implemented strategies designed to strengthen primary care.
So when we're thinking in terms of the portal itself, I looked at the initial kind of rollout back a few years ago when they came out with the first iteration of it, and really wasn't doing much more than our website was doing, and so I elected to just wait. But now with the newest upgrade over the past probably 2 years, maybe 18 months, where we've really tried to put the portal into practice, it's much more functional. But we're much happier with it now as we've used it not only for just the standard kind of back and forth communication with patients, but to begin to start to manage medical records through the portal. We've got 40% signed up roughly on the portal. The way we did that initially was just encourage use of the portal through website communication, prize drawings, in-office education, just trying to get people to sign up. We resisted the temptation to add more phone lines and started to encourage people when they started to maybe tell us a little bit about getting a busy signal on the telephone that the portal is able to access us directly, during business hours, right to the physician's desk. And probably, 10% of those people are actively using the portal to communicate with us, to get records, and to check things, to make corrections to their medical record and immunizations and things like that. The way I like it best is really to have our office being able to initiate contact with the patient, first of all, just by reminding about appointments. The portal is set up once a patient is active on it, that it will send out a reminder for visits automatically as they come up. And again, it's one thing to have the reminder go out. It's another thing to have the patient actually see the reminder. And we can tell if they've viewed it. Little green check mark will go on the reminder when we can see that they've actually viewed the reminder for their upcoming appointment. Both us kind of reaching out to them for appointment reminders, and then other issues reaching out from the office with respect to health maintenance, wellness reminders. It's more positive from them being able to access information that they want, whether it's records or whether it's being able to address a question or concern coming at us and getting a response directly back from physician as opposed to mediated through a different callback person. The people who actively use the portal probably like that the best. It all boils down to how we do data capture in the office. By data capture, we just mean whatever information is coming at us from whichever direction. However that data is coming into the office, we've got protocols in place to get that uploaded into the chart. From there is how we can share all that information out onto the patient portal as we make it available. Either I'm seeing it directly or it'll come to me for review and a task. And by task out, I just mean that I look at that information, and sometimes if it's lab information or hospital imaging information, I can task directly out through the portal to the patient with results. I can either make it available or I can attach the result right to the portal note. So I can task out directly to the patient. That actually then takes the MAs and our administrative people out of the loop. I'm hoping I can cut down on our phone callbacks by 30 or 40% by tasking out directly to the patient. And then the nice part about the portal feature is I can tell when the patient's viewed it, and I'll give them a couple of days to view it. And if it's important enough and I see that they haven't viewed it, we'll probably end up following that up with a phone call just to make sure. From the doctor-patient perspective, I think the portal has the potential to be actually a little bit more personal in communication, because generally those phone calls I'm relaying back through staff back to the patient. And if there's another question that kind of comes up, we can go around and around, back and forth. But that back and forth between doctor and patient, I think, can happen more efficiently and even more personally with the portal itself, because you're going back and forth. And if it gets too complicated, ultimately I'll just say, as the last portal, please schedule an office visit and we can clarify this more so that we don't end up going back and forth, 10 times. I was worried doing this, I was just going to get inundated, but it's been the other way around. As doing this over the last 11 years, just seeing just how slowly, it's almost like a turtle. People start to kind of see what it is and how they use it, and they start to use it, and then it starts to grow. And now I'm actually at the point where we're seeing, well, wow, this really has some potential to really be more than just, doing it to report data to agencies and to get meaningful use, but actually start to employ some of these platforms to see how it works.
For more information and resources, visit the Comprehensive Primary Care Initiative webpage. Go to innovation.cms.gov and search for the CPC Innovation Model. This has been a production of TMF Health Quality Institute.